everybody, my name is Dr. May Burridge and I'm one of the family physicians here at the Uxbridge Health Centre. I'm here today to film another video for you guys answering some more of your questions about COVID-19. Firstly, I'd like to say thank you to everyone who's given us their questions so far. We hope that our answers have been helpful and keep them coming. It's been really great to see what all you guys want to know. In terms of before we start answering questions, I do want to do a little bit of a disclaimer before we start this video. As you guys probably have seen, the knowledge we have around COVID and the information we find out is very fluid. It changes pretty much every day. So the information we're going to give in this video is current as of today, which is April 3rd, 2020, but things are changing all the time. So if you see something on this video which you think might not be quite up to date, please feel free to check in with us and clarify. But we're going to give you the best information that we can as of this time. Alrighty, so let's get going to the questions. The first few questions I'm going to bundle together because they're kind of all related into one slot. So the first question is there any confirmed cases of COVID in Uxbridge? This was in relation to hearing from a number of people around town that there is. There was also an article in ET Canada which mentioned a large number of cases at the set of Schitt's Creek, which I think is in our own Goodwood. The article was then edited and then taken down. So if there are cases, how is it not being relayed to the community? And then another one how will we be informed of any infected people in Uxbridge, whether they're due to travelling or more importantly, community infection transmission? And I've also had a lot of people calling in asking about their symptoms, what to look out for, is it COVID, is it not? So I'm going to try to cover all of this in one section for you guys, so apologies, it might take a little while, but hopefully it all makes sense at the end. So in terms of where you're getting your information about COVID, I think that's a really important point to cover. There has been a lot of media coverage of what's going on, and understandably it's a big thing. The world has changed in a matter of a couple of weeks for us, and there's a lot that we have to get our heads around. Now, I will say that your commercial newspapers, ET Canada, all those kind of sites are probably not your prime resource for this kind of medical information. I think that specific ET Canada article actually had a large amount of mistakes in it, and hence it was retracted in the end. So I would say that if you're somebody who's wanting to know things like numbers, those kinds of details, some people will find that stressful and that's okay. But if you're someone that finds that really helpful, then I would recommend that you go to certain resources. One is Public Health Durham have a COVID update on their website, which specifically tells us about the number of cases in the Durham region. The other one is the World Health Organization. All those kind of medical resources would be a good place. And of course, if you have questions, you can always ask your family doctors or call in here to the health center and we'll be able to guide you as best we can. So secondly from that, we will try to put the link in that Durham Health COVID update website in this post. For anyone who's interested, you can just check in on the numbers. In terms of in Uxbridge locally, we have very recently had confirmed cases of COVID. I think the number as of today is about 3 cases confirmed. Now we can't give you any details of those cases, who they were, how it was contracted for privacy reasons of course, but we do know that it is in our town. What we do also know, having fielded the calls here at the clinic, there are also a lot of people in the community who have symptoms, say fever, shortness of breath, with travel, without travel, but right now, when people have any symptoms, we assume it could be possible COVID, and that's what we need to do to keep our town safe. So we should assume that there's more cases in the community than what we've tested for, and when it comes to community spread, so that means possible COVID in a patient that hasn't traveled or hasn't had contact with someone else that has confirmed COVID, we really need to assume it's here already. Really the bottom line is, with this kind of thing, the number of the cases, it's important for us to know for a planning perspective in terms of the health care and making sure we have enough resources, but in terms of what we need to do as a community, the number is not going to change what we should be doing now. We need to work early, we need to do the best thing we can to slow the spread of this, to reduce the effects on our community and keep our vulnerable population and healthcare workers and essential workers safe. So what does that mean? That means we need to really be good at our social distancing, and I mean serious social distancing. It might seem silly, I think we're all getting better at it and getting used to it, but we really need to focus staying apart from people that aren't in our household, only going out for essential things like shopping once a week, reducing our interaction with other people, When you go out, wash your hands, keep them clean. That's going to be, if anything's on surfaces, washing your hands before you touch your face and mouth, that's what's going to keep you safe. Okay? If you know vulnerable people, say people that are elderly or with chronic health conditions, staying away from them is going to keep them safe. But helping them with things like shopping and all those other activities that they might not be able to leave the house to do will be amazing. If you are in that higher risk population and you're struggling or you need some help, please call us, because we do know of a lot of wonderful groups in the community that can help you with some of these activities and errands. So please reach out. The town is really gathering around everyone to help, which has been really great to see. And then the other thing is, if you do show any signs of symptoms, so any fever, cough, runny nose, even if it's your allergies, stay at home. Don't go out and visit people. Don't say, oh, it's just a cold, because we're finding that, especially in the younger population, the symptoms are so variable. It can even be just tummy upset. It can be a headache, and that's all that some people get. If you're feeling unwell, stay at home. That's not going out walking the dog. That's not going out and getting the groceries. Get someone to help you. Call your family doctor to talk about your symptoms. If they're mild, then there's not really much we can do about it. There's no treatment. Most people will have a very mild course and it will go away on its own and you'll be okay. If they're getting more severe or you're concerned, call your doctor and we'll help direct you on exactly what to do. But the key is now, stay home and don't spread it around the town. That's the best thing we're going to be able to do to help us get through this together. Okay, so sorry about that long one. Hopefully the rest will be a little bit shorter for you guys. So the next question is, what if a child or adult under 60 has asthma? Would they be at a higher risk? So this is a very good question, because we know that in the past, anyone that has a diagnosis of any chronic lung disease, including asthma, even COPD, tend to be at higher risk of more severe illness when they get respiratory infections, whether that's the flu, cold, influenza. In general, this is still the case with COVID. If you have underlying asthma, you may get more severe symptoms. However, especially in the younger population, less than 60, that group in general tend to do a lot better with COVID than anyone over 60. So while you possibly might get a bit more short of breath, you might feel more symptomatic than someone without asthma, it doesn't necessarily mean you will need to be hospitalized or need invasive treatment. The most important thing to do for anyone with asthma is to make sure that it's well controlled. So make sure you have enough medications, and I don't mean you need to buy 10 puffers, because we're getting them in, the supply is there, but make sure you have enough that you would normally need to prepare for any exacerbations you might get in the winter. Make sure that it's well controlled. So if you're having symptoms every single day and you need your blue puffer every single day, you should talk to your family doctor to see if there's another medication that we could add to improve that control. If you have better baseline control of your asthma, you're going to do better if you get sick. And that goes for anything, not just COVID. Alrighty, so, the other little point I wanted to add for that, with children specifically, we have found that children do very, very well regardless of comorbidities, asthma, or otherwise. Looking at the data from thousands of people in Wuhan, in China, there were no infant deaths in China of a very large number of kids. So even if your kid does have one of these conditions, don't worry, make sure it's managed well and keep an eye on them. They mostly have very mild or sometimes completely asymptomatic courses of COVID. Alright, next question. So I am a 90-year-old in good health and had a pneumonia shot about 10 years ago. Do I need another? This is another excellent question. You guys are bringing up really, really good points. So thank you so much. So pneumonia vaccines. Super important basically for anyone. We recommend a pneumonia shot. Anyone over the age of 65, you should have had at least one shot. When it comes to COVID pneumonia, the pneumonia vaccine doesn't protect you against COVID, because it is a virus. However, you can get a secondary pneumonia from COVID, and at any point when there's a respiratory infection involved, we want to make sure you have the best protection possible. So that's the first question. So if somebody hasn't had a pneumonia shot, you're over 65, you should definitely call your doctor and make sure you get one. We're still doing immunizations at this time. It's a very important thing to do. In terms of a booster, there is not a booster specifically for the normal pneumonia vaccine we give out. However, there is a second pneumonia vaccine. Its name is Prevnar 13, which currently, unfortunately, is not covered by the government, but it is recommended that you have both of those vaccines to give you the most protection from pneumonia as absolutely possible. So I would say that anyone who has only had one pneumonia shot at this stage, or anyone that's over 50 years old that has chronic disease such as asthma or diabetes, should consider getting this extra pneumonia shot. Again, unfortunately, it is not covered by the government. If you have benefits, it is covered, but it is an important thing and will give you good protection. So if you're interested in this, you should talk to your family doctor or call one of us at the clinic, and we can help you figure out if that's right for you and give you some more information. Okay. Are there any vitamins or herbal supplements that could be taken to reduce the symptoms of COVID or help ward it off? So the only natural thing that we have evidence for in terms of preventing COVID really is vitamin SAH, and that is vitamin stay at home. Other than that, we don't really have any clear evidence for any vitamins, herbal substances, or anything like that that can ward off or protect you against COVID. Now, I do want you guys to be careful because there have been a lot of companies, a lot of products that have been advertised to have this effect, and none of these have been trialed, none of these have been approved by the FDA for this purpose. So again, don't believe everything you read. Right now, unfortunately, we haven't seen any evidence that that could be helpful in this circumstance. As always, if you are considering adding a herbal supplement or taking something different, do talk to your doctor, because a lot of these over-the-counter remedies can have interactions with your current medications or might not be the best to take depending on your health and medical condition. So always reach out to us to check before taking anything new, but nothing that we could recommend with evidence that would help give you more protection in this time. Okay. More medication questions. This one I know has been in the media a lot, especially out of the US. So the question is, I just read some news about the use of hydroxychloroquine with and without azithromycin to treat COVID-19. What are your thoughts? So again, media has been really great in this in terms of encouraging people to do the right things, getting information out there, but a lot of what you see in the media is kind of just an overshadowing of what is the case. So currently, there may be some evidence that this is helpful. They've tried it in a few cases in other countries and think that maybe it could be good, but we really don't have enough information to know if that's the case. These medications, particularly when used together, can have some very severe side effects. So it's definitely not something we would ever recommend taking without consulting your physician first. And again, you probably wouldn't be able to get a prescription anyway. It is still very experimental right now. So at the moment in Canada, the way it's working with trialing these medications, when people are admitted to hospital with proven COVID, if they have severe symptoms that aren't improving, if they're in the ICU and need a breathing tube, that's when we're doing trials, adding this medication for what it's worth, because we know, because they're so severely ill and we can monitor them closely, we know in that context we can make decisions and keep people safe and see if it's helpful. Right now, it is not recommended or approved for anyone in the general population, anyone doing well outside of hospital. Okay, if you take this medication for another reason, keep taking it as normal. Don't change anything. Please don't stockpile your medications, though. Don't hoard them. Like, it will still be working for it to still be available for everyone. Don't keep a whole lot of it either, because that's not going to help us in the long term. So right now, only sick people and only severely ill people, and only with the approval of a specialist infectious disease doctor is that combination of medication available. And hopefully we'll see with time how effective it is. Okay, so I've heard of the use of Tylenol being recommended instead of Advil for fever and body pains if COVID-19 is suspected or present. What are your thoughts? So this question comes from a statement that was made from the Health Institute in France, that they had observed that a number of their COVID-19 patients that had quite significant illness also had used Advil over the course of their disease. Now, what this means is kind of hard to tell. I mean, Advil is used to treat body pains and fevers for many viruses, and so did this more severe symptoms come on in direct relation to Advil, or did it just so happen that lots of people took Advil because they had symptoms that Advil treats? and really the severity of the symptoms did not relate to that at all. Right now, the official stance, particularly from the World Health Organization, who's kind of like the global word on medical recommendations, and even the Canadian Pediatric Society have said that there's not enough evidence to say that Advil is harmful or causes worse outcomes in COVID-19. So right now, there is definitely no blanket recommendation that you should not take Advil if you have COVID symptoms. However, if you have Tylenol available and you have the option of using that instead of Advil, it's very reasonable to choose that preferentially and leave the Advil unless it's really, really necessary. Again, there are some people out there who can't use Advil. So our elderly population, our vulnerable population, they can't use it because it has bad effects on kidneys. It can have some effects on the stomach, especially in the older age group. So again, please don't go out and buy all the Tylenol that's on the shelf. We're still making it. You'll still be able to get it. If it will be like another toilet paper situation if everyone goes and buys all the Tylenol, and then our poor elderly people will be stuck without anything to help with their symptoms through this disease. So please be rational, be reasonable. If you can avoid Advil, it's very safe to do so, but there's nothing to say that it absolutely can't be used. And lucky last one, thanks for sticking with me through all of these, guys. We had a lot of questions this week. And this one's a tough one. So you have provided info for older people over 80 in regards to outcomes of COVID and what we call advanced care planning. Do you have any similar stats for younger seniors, say 65 to 80, so that we too can make better decisions? So another excellent question. This topic is so important, and it's a really tough one. So I think this one probably stemmed from a recent newsletter that our own Dr. Wilson and Dr. Jensen released, talking about how even though it's difficult and it's tough, now is a really good time to make sure you think about what would you want to happen to you if you got very, very sick? How far would you want us to go? And talking to your families about this so that they know that if they have to make a tough decision, they know exactly where you stand and what you want. We do have, our own Dr. Jensen has made a wonderful video, which is also on this Facebook page, talking about some information and some statistics for the over 80 populations as referenced in the question. And I do recommend that you do watch that. It's very informative and can help guide you in this important topic. In terms of people less than 80, so what we do know from the studies from Wuhan and Italy and the other countries that have been affected by this is that people less than 60 in general tend to do pretty well with this disease. There's always going to be that statistical anomaly that one person who is well and young had a very severe disease, but in general we know people less than 60 generally have a fairly reasonable course. Maybe some of them need hospitalization just for some oxygen therapy, but in terms of like intubation and really significant invasive procedures, less than 60 tend to do well. We also know that people over 80 have the highest risk of death from this. At the moment, the numbers are looking about around 15% of people over 80, unfortunately, will pass away from COVID. That is still that still means 85% of people do fine, but 15% in that age group is a significant number, so we have to make sure that we're having these discussions. 60 to 80, it's a little bit more of a grey zone. So the death rate, or the rate of mortality as we call it, is not nearly as high as in the above 80, but we know between 60 and 80 it is more than the younger age group. So what does that mean for you? So we know that in general, when we look at all age groups and what's been happening with COVID across the world, in general, of all the COVID cases in all the age group, about 15% of people will need to be in hospital. Overall, 15%. So 85% of people will have a very mild course, not need to be in hospital, just take some Tylenol, stay at home, rest, watch lots of Netflix, and then they'll be okay. Of those 15% that end up in hospital, about 30% of those, about a third of those, I should say, will end up needing more invasive treatment in the ICU. So that's a breathing tube, medications to support blood pressure, and usually it's a reasonably long admission, like we're looking on average about 2 weeks on a breathing tube sedated right now. Of those, that 1/3 of people that do end up intubated, only about 50% survive. So that's pretty significant in terms of numbers. Once you get to ICU, what is your survival going to be? And then if you do survive, what that recovery will look like for you. Like, will you need some rehabilitation? Will you need extra care at home? Will you need long-term care? A lot of that really comes down to many factors. One being age, but the other also being what other health conditions you have. What was your health like before you got sick? So, for example, a 70-year-old on no medications with absolutely no medical conditions is probably likely to do a little bit better than, say, a 60-year-old that has many diseases like diabetes or renal failure or high blood pressure or things like that. That's something that needs to be taken into consideration very carefully when you talk about what you want to do and how far you want to go to look after yourself. And a lot of it comes into thinking about what's it going to look like for me if I survive, what are my chances of surviving, and is that acceptable for me, and do I want to go through that or not. So in terms of those numbers, again, not a clear answer, it's a little bit grey, but I would urge anyone who's thinking about this, and everyone should be thinking about this to a degree, like not to be morbid, but think about what you would want to happen to you if you were to get severely sick. This will help your family in a very difficult time if they have to make any decisions, knowing what your thoughts were on this. But call your family doctor. We're here to talk about this. We're here to help you guys through this. We know your health, we can talk about your conditions, give you some more of idea of how this would look like for you. And you know what? It's an important topic, and it's a scary time, and it's a hard thing to talk about, but this is important for your health at any time, whether we're in COVID or whether we're just talking about general health if something were to happen. So please call us, we're here for you to go through all these kind of difficult but very important conversations. So I guess this is the end of my talk for today. I hope that was informative for everybody. Now do remember that if you have any questions, you have any concerns, we are available here at the Uxbridge Health Centre to talk you through what's going on. And I think seeing what's happening in this community so far and everyone banded together, we're doing really, really well. We just need to start amping it up and doing as much as we possibly can, but together we'll get through it and we'll be fine. Okay, thanks everyone. Bye.